Today, I want to talk about something that we all do as being human, and it has significant impacts on our society. I'll start by taking us back nearly 3 years ago, when the murder of George Floyd and resulting protests across the world led to many conversations and a racial reckoning in the United States, as many people's eyes were opened to the inequities faced by millions in our society. Witnessing bias and stigma in this form was shocking and hard to miss. It was right there, in your face. There's another form of bias, however, that is much sneakier and more difficult to detect, but it can still be quite harmful. As myself, everyone in this room, and in fact all human beings process information, we naturally sort and group things. This method of information processing is so natural, in fact, that we don't even realize that we're doing it. It occurs at the level of the unconscious mind. While sorting things into groups helps humans make decisions faster and likely add evolutionary benefits, there are downsides. This type of information processing can affect how we interact with and think about other people, even introducing or reinforcing stereotypes. Scientists call this implicit bias. Implicit bias can be an issue in many parts of society. Just think how this might impact who gets hired for a job or how the media reports a story. Healthcare also has issues with implicit bias. In fact, a 2015 research review of implicit bias among healthcare providers found that most providers expressed low to moderate levels of implicit bias. Just imagine, you're a patient sitting in a doctor's office, and during your visit, the doctor seems distrustful, distant, or even fearful. As a result, your doctor recommends a treatment to you without sharing the decision-making, and you are less motivated to listen to your doctor's recommendations. As this example has just demonstrated, implicit bias can change how doctors or nurses treat their patients, which can damage patient-provider relationships and lead to health disparities. Given that implicit bias in healthcare is a known issue, this introduces the question, can we identify instances of implicit bias in healthcare encounters and come up with solutions to address it? My research is focused on using computer tools to answer this very question. My name is Barrett, and I study health and biomedical informatics. Today, I'll take you through my proposed research that seeks to develop methods to identify implicit bias in clinical notes, explore the association between implicit bias and future patient health outcomes, and determine if there are certain patient groups that tend to have healthcare encounters with more or less bias as compared to other patients. I'll begin by conducting this research among patients living with the human immunodeficiency virus, or HIV, because these individuals face a higher risk of experiencing bias and stigma, and implicit bias can limit access to life-saving treatments. The ultimate goal of this proposed research is to guide the development of real-world interventions that reduce disparities in patient health outcomes and improve healthcare quality and equity. Now, if you've ever been to the doctor and it seems like they're constantly typing into their computer, what they're doing is taking notes. There's currently no state-of-the-art method for identifying implicit bias in clinical notes. In my approach, I will draw from prior research that identified common themes of stigmatizing language used by doctors in patient medical records. These common themes included questioning patient credibility, disapproval of the patient, racial or social class stereotyping of the patient, portraying the patient as difficult, and emphasizing the doctor-patient power dynamic. I will develop computer algorithms that search for these common stigmatizing language themes within the clinical notes of patients living with HIV in order to identify cases of implicit bias. Once healthcare encounters have been labeled as expressing implicit bias or not, I will explore the association between biased healthcare encounters and future patient health outcomes. I'll specifically see if patients with biased healthcare encounters have a higher risk of unsuppressed HIV viral load, significant depression symptoms, or a cardiovascular event within 1 year of the encounter as compared to patients without these biased encounters. Examining multiple patient health outcomes will allow me to see if the association between implicit bias and patient health is global or specific to certain diseases, which could give an indication as to the mechanisms involved. And finally, I'll determine if there are certain patient groups that have a higher risk of experiencing implicit bias within their healthcare encounters. I'll specifically look at patients in social minority groups, elder individuals, racial or ethnic minorities, gender or sexual orientation minorities, or injection drug users, relative to patients in the social majority. I'll also consider various intersections of these patient identities to see how that might change the likelihood of having a healthcare encounter that contained implicit bias. My hope is that with this proposed research, we can guide the development of real-world interventions that mitigate the harms of implicit bias in healthcare and reduce health disparities. For example, computer programs can be developed that detect biased clinical notes and flag these patients for extra review by other healthcare providers to ensure that treatment recommendations are appropriate. Additionally, cultural competency training could be mandated, or specific providers could be identified for targeted interventions. It is only through initiatives that purposely seek to counteract the harmful effects of bias and stigma that we can collectively move towards the realization of a society that provides equity and justice for all. Thank you.